Hi, my name is Dr. Emily Rule. I'm a pelvic floor physical therapist and the owner of Wings Physiotherapy in Apple Valley, California. Today, we're going to talk just a little bit about what pelvic health is, a little bit about the anatomy of the pelvic floor, how it works, and why it's important. So let's start with the anatomy of the pelvic floor. You can think of your pelvis as a big bowl, and the pelvic floor muscles, this red part here, is like a hammock that forms at the bottom of this bowl. So your pelvis, the bony part is the bowl. This is the bottom of your bowl. So you can see the pelvic floor muscles from the inside and also from the bottom. So the pelvic floor is super important and it does four main functions. So the first one is it supports all of the abdominal organs. So they sit in that bowl there, not like that obviously, but so the pelvic floor organs sit there. In this picture here, you can see in the front, this is the bladder, and then you have your uterus here and the rectum. This is female anatomy. This view is like if I cut you in half down this way, and we're looking at the side. So this part here is your pubic bone, and then in the back, the tailbone. You can actually see the pelvic floor muscles in this picture here, stretching all the way from the pubic bone back to your tailbone. So that's the first thing that they do is they support the abdominal organs. The pelvic floor muscles also have lots of muscles that help to control things like peeing and pooping. So the pelvic floor muscles stay tight when you want to keep pee or poop in, and then they relax and let go and let those holes open, so either your urethra or your anus when you're ready to pee or poop. The pelvic floor muscles play a role in sexual functions. So they are important in orgasm, they're important in allowing penetration and increasing pleasure during intimacy with your partner. The last thing that the pelvic floor does is it's part of your core. So a lot of times when we talk about our core, we think of our rectus abdominis or our six-pack muscles, but there's so much more that's involved. Your pelvic floor is the bottom of that core. So on the top, you have your diaphragm. In the front, you have your abdominals. The back side is going to be your back muscles, and then your pelvic floor is the bottom of that. So that's the last component. I hear it a lot that I had kids, and now every time I sneeze or every time I laugh, when I want to go jump on the trampoline with my kids or I want to run, I pee my pants. And as women, it's kind of a stigma that when you have kids, that's just going to happen and it's something that you have to deal with. That is not true with pelvic floor muscle training. You can regain continence, be able to go on the trampoline with your kids, get back to running, get out of the shower without peeing your pants. There's so many things that we can do to help you. It might be very common that peeing happens with these activities, but it's not normal. It's your body's way of telling you that the pelvic floor isn't working the way it was designed to. So some conditions that the pelvic floor can have are urinary and fecal incontinence. So this might be just a few drops of pee. Some people think I don't pee my pants because it's only a drop or two. I don't lose full control of my bladder. That still counts as incontinence, and it's still something that we can help you with. And it's not only urine or pee, but people also can have fecal incontinence, whether that be not being able to hold in poop or sometimes not even having control of passing gas. Another thing that can happen when the pelvic floor isn't working right is what we call dyspareunia. And that's when sex is painful. Sex shouldn't be painful. And a lot of times that's due to tight, overactive pelvic floor muscles, and we need to train them to relax so that we can have intimacy. Another big thing with the pelvic floor is pelvic organ prolapse. So prolapse is when one of these organs, so you've got all of these that sit in here, they can actually start to fall through the vagina. And you actually, sometimes, depending on how severe they are, can see them actually come out of the vagina. So there's different stages, but prolapse is essentially just the falling of one of those three organs into the vaginal canal. And if you have prolapse, that can lead to other symptoms like incontinence, pelvic pain. Why doesn't my pelvic floor work? Well, there's so many different things. Childbirth is one of the main causes of pelvic floor dysfunction. But there's so many different types. So your pelvic floor might be weak so that it can't support, or those holes aren't strong enough to stay closed when you want them to. Your pelvic floor muscles might be uncoordinated. So they might have some strength, but if they aren't squeezing when they should be and relaxing when they should be, then they're not going to be able to do their job properly. You might have bad posture. So a lot of times we sit all day and our pelvis is tilted forward just a little bit from that sitting posture. That can lead to all kinds of issues with the pelvic floor. Now, what is pelvic floor physical therapy? The goal of pelvic floor physical therapy is going to return those muscles to optimal function, to do what they were designed to do the way they were designed to do it. Like I had mentioned, some people have those overactive pelvic floor muscles and they're really tight, but other people have underactive and they can hardly squeeze them at all. And each one is going to require a different treatment approach. So a lot of times when people have pelvic floor dysfunction, they're told to just do some Kegels and things will get better. This is actually the worst thing that you can do if you have an overactive pelvic floor, because that's just going to make your symptoms worse. It's going to cause pain, or if you already have pain, that can cause more pain. So it's really important that you're having pelvic floor issues. Go see somebody who specializes in pelvic floor physical therapy, because they can help you to determine what's going on. Are your muscles too weak and underactive? Are they overactive and super tight? And what should you do? So just like any other muscle in our body, like our biceps or our hamstrings, our glutes, the pelvic floor muscle is the same type of muscle, and we can work on it. We can strengthen it, we can stretch it, we can help to relax it. There's all kinds of things we can do. So exercises along with lifestyle changes can make a huge impact in pelvic floor problems. What about a pelvic exam? So it's very common when you see a pelvic floor physical therapist that they're going to want to do an internal exam. So what they would do is go in vaginally, and so that they can feel and assess those muscles. I know this can be super scary, but just relax. An internal exam is going to be the most accurate and give us the most information about what's going on in your pelvic floor. But if there's some reason that you can't do an internal exam, you don't want to do an internal exam, talk with your provider, because we can feel around those muscles externally, and we can kind of work with you. But just know that for us to help you the best, getting our hands on the pelvic floor muscles are what's going to be the most beneficial. I will say that when you come for your pelvic exam, you don't need to worry about shaving. You don't need to worry about being on your period. We're used to those things, and we don't care, so you shouldn't care. Like I said, there's other things that we can do outside of the pelvic floor. We're going to address any hip issues, back issues, knee issues, you name it. But an internal exam is going to be the best. So how do you find a pelvic floor physical therapist? There's a couple different ways. You can ask your physician to send you a referral. Sometimes physicians don't know about pelvic floor physical therapy, and you can find one on your own. So whatever your favorite search engine is, type in pelvic floor physical therapist near me. You can go to mypfm.com, and they have a link at the top that says find a PT. You can also go to the Academy of Pelvic Health or Herman and Wallace. Those are two organizations that actually do training for physical therapists on how to be a pelvic health provider, and they list the therapists that they train on their website, so you can search by your location there. If you have any questions, feel free to leave them in the comments below, and I hope this helped.